I'm going to just go by pseudonym because I don't want to get in trouble with my job because
Sure.
I'm probably going to talk crap about it.
Okay.
So just call me the Cena Socialist.
The what socialist?
Cena, C-N-A Socialist.
Okay, like John Cena.
Okay, so no, more like a certified nursing aide.
Okay.
But anyway, so I'm in Michigan. I work in an ICU here in one of the local hospitals. And just to kind of echo with like what that nurse was talking about on that video that you showed at the beginning, man, it is really shit right now. Like, it is horrible here. Like, oh man, we are so freaking strapped for nurses. Like, I think right now in our ICU, the only two people who are full-time staff is me and one other nurse, and the rest are like the agency nurses, which he was talking about.
Right.
And they're frequently like nurses with 4 patients, 3 patients, and all these people coming in are just unvaccinated. Like, it's crazy. And like the people who die who are vaccinated have like cancer. You know what I mean? Like, vaccine wasn't going to help them. You know what I'm saying? So it's crazy right now in Michigan.
And in terms of something like monoclonal antibodies, what's been your experience with those treatments and their availability for Omicron?
To be personally honest, like, I don't know much about like the new variant, like how many, like, because when we test people when they come to the hospital, it's not like you go to a, you know, they test them and they go, oh, you have the Delta variant, you have the, you know, whatever the new variant. I can't really pronounce it.
Omicron.
It's just you have COVID.
Yeah.
Yeah. And so I personally really haven't seen like that get used that much at like the hospital that I work at, to be perfectly honest. Like, I haven't really seen that used a whole lot. Like, I had a friend who's also a coworker with me, and she had COVID and she got that, but she had to go somewhere else, like to a special facility to have that done. And that was like really expensive when it comes to, like, because the hospital I'm at is like it serves a really low income area, and I can.
Is it a private hospital?
Oh yeah.
Yeah.
Oh yeah. I mean, it's like one of the hospitals that got picked up after, you know, the recession by, you know, just a company trying to, you know, buy out failing hospitals that were publicly owned. So it's bad. And like, so you'll have like the nurse like had mentioned that like there are nurses making like $35 an hour, like working in the ICU, doing the same thing as the nurse next to them who's making like 90 with these travel agency things. And I don't know, to make like a kind of like a labor point, because I don't want to drag this on too long and take up too much time. But it's like when you work like that, like you're kind of like an Uber driver of nurses. Like if I understand it correctly. And to be honest, it's not like you really have any labor protections beyond like the company who is sponsoring you, I guess, is like the agency. And I just feel like if that's the way nursing is going, like it's just not like, because I'm in nursing school, right? Like I'm going to be a nurse, but like, if that's the way it's going, like, I mean, that's like horrible for labor. I mean, unless you unionize, but there's such like an anti-union, you know, like sentiment in not in nursing, but just like people are very scared of that idea.
Well, also there are,
at least where I'm at, you know,
there are massive barriers to it just based on the fact that Michigan is a right to work state.
Right. Yeah. And exactly. And you know what? It sucks too, is that I've got like people in my family that I've talked to this about. And they're like, well, they just need to unionize. And it's like, well, it's not that easy.
Yeah.
Like, you can't just unionize. Like, I wish it were that easy. Like, that'd be great, but it's not at all.
And there needs to be some sort of blueprint for people for them to understand what's possible.
Right.
And there's just a whole
there's no footwork.
There's just a whole generation of people who's, you know, I don't know how old you are, but my generation, parents and people since the union movement and since unions have been on the decline, who weren't a part of a generation that has a really strong labor movement, and there just aren't as many parents and people around people that are young for them to understand that that's kind of possible, right?
Right. And like, so I'm 23, and like my whole family is all union people. In public sector unions. So like I was, you know, fortunate enough to grow up around that culture and like be really involved with it.
Right.
You know, so when I talk about that to like people who I work with, they're like, well, I mean, you know, they kind of spit out those talking points that you would hear on like Fox News is like, well, then we're all going to make less money. And it's like, well, not really, dude. Like, you know, it's not like it works like that. I mean, nurses who are unionized make a lot more than nurses who are not unionized, you know? So, but yeah, it's very crazy here. Like, everybody who comes in with COVID is very sick. I think I've seen like one person come off the ventilator. The rest are just, you know, I mean, they die. I mean, I don't know how to put it anymore. Like,
no, it's important you just say
die.
that. It's important you say that.
Yeah, I mean,
right.
like I mean, like the other night, like I said, we're so short-staffed. Like, I hurt my back at work doing CPR on somebody because I did like 4 rounds of CPR on a patient out of like 8 or 9 rounds because there was just nobody there to do things. The nurse is like hanging, you know, medicine on this patient, and I'm doing CPR. It's like you can't, you know, there isn't enough people there to do things, and this is with COVID patients. So like, if you're not a COVID patient and you're there, like if you're, you know, if you code, I mean, and you're all the other people are dealing with another code for a COVID patient. I mean, it's like, it's not only the COVID stuff like affecting just people who by no means against them, like are there for other things that they need to be there for, like heart issues, like, you know, so it's just, I don't know. It's all very, very insane right now.
Yeah, I just saw, speaking of that point you made, Steven Crowder tweeted, why would a vaccinated individual need a hospital bed? And
yeah,
it's exactly.
I mean, it's not like heart attacks exist or anything, or stroke.
Yeah, or any other medical condition. COVID's replaced it all.
Mm-hmm. Mm-hmm. Yeah, no, I mean, exactly. You know, I mean, it's not like people go to the hospital for like hernias. You know, I guess I've never had that. No, that's a stupid point. But I mean,
exactly.
Steven Crowder can go to the hospital, and you know,
he has gone recently, so he should know. He should know honestly about a hospital bed since he just had a procedure in one. But
I know. I'm sorry. I hate to drag this call on. I'm sorry.
No, it's not.
There's like so much like and sometimes really like I'm not even gonna lie, like the audacity of some of the patients too. Like I had to straight up tell a guy, and I mean, I don't know if he's still even there. He might be gone. I haven't been to work in like a week, but I had to tell a guy because he was not intubated that if he did not keep his oxygen mask on, he was probably going to die. And he was just like, okay, and just kept taking it off. And it's like, I get it. I don't want to wear an oxygen mask. That sucks. It probably doesn't feel great. You know what feels worse? Me, a 300-pound guy, doing CPR on your chest.
Yeah.
That hurts a lot more. But he didn't get that point. And, you know.
And is that how you hurt your back?
Not on that guy, no. Somebody else. But, I mean, it's just like, I had to tell him straight up. I was like, look, dude, I punch in, I punch out, I go home, I play with my dog. Like, I don't care. Like, if you die during the night, like, I go home, play with my dog. I don't care. I punch out. It's a job. Like, because at this point, it's so, like, it's
you
just
have
tiring
to,
with these people.
Yeah, you have to, like, kind of have some, you have to put up a wall for your emotions, and, like, you have to look out for yourself. I understand. But,
yeah, I mean, it sounds dark. Like, it's just, but at this point, it's just like,
it is dark.
If I go in and somebody dies, like, I mean, it's just like, it's another day for me. I mean, whatever.
But yeah, I mean, I think this sort of thing is way underemphasized, like the toll that it's taken on healthcare workers and the type of folks that just have been downplaying the need to slow spreads and, you know, take precautions against COVID, like vaccinations. I mean, it's really despicable.
All right, well, I appreciate oh, sorry, go on.
But no, I'm sorry. I appreciate you guys taking my call and just letting me rant a little bit. Appreciate it.
All right, Cena Socialist. Thank you.
See you guys. Bye.
Later. I'm glad.
I just don't know, like, do people not know people who work in healthcare? Because, like, this is what you hear from people who work these jobs. It sucks because people are taking the virus seriously. And it's and obviously it's just a horrible virus in itself. But, like, I mean, that, I don't know, man. That somebody at the end of life would be telling a doctor to cure their husband with ivermectin or something like that, like I saw on like a Reddit post. I don't know if it's true, but like given what Brett Weinstein said on Joe Rogan that we could end the pandemic now with ivermectin, like it's disgusting. And I really feel bad for all of the medical professionals that have to deal with it, and all the media professionals who have been irresponsible are very lucky that more of this sort of stuff doesn't get out because people are too fucking tired to call into a radio show about it.
Yeah.